Hello everyone. Good evening one and all. I am Harsh Marathe, Senior Academic Secretary, 3rd minor MBBS. I welcome you all to this guidance session. Before beginning, I would like to point out the purpose of this session. Suppose you are a sailor and you are trying to find a shore. If you sail uncharted, it is very unlikely that you will find the destination. But if you have the right direction, then it is very easy to reach the destination. And to point this direction, we are here to help you. So in this session, we will introduce you that how you should approach for studying for your practical exams. So first, we'll learn about approach to pharmacology practicals. For this, our speaker is Amay Ambike, 3rd minor MBBS, Senior Academic Secretary. Over to you, Amay.
Hello everyone, my name is Amay Ambike. I'll be covering how to approach pharmacology practicals. Just a second. So first of all, you should know the format before approaching the exam. So for MUHS final exam and for your internal exams, that is first, second and your prelim exam, the format is different. The only difference, as you can see on the screen, is this 10 marks for logbook or journal, which is there in the prelim exams and your internal exams. So clinical pharmacy is 20 marks, clinical pharmacology is 30 marks, experimental pharmacology is 10 marks, communication is 10 marks, which brings a total of 70 marks for practical, and your viva here is of 20 marks, whereas your logbook and journal is for 10 marks, bringing the total to 100. Now, unlike Patho and Micro, Pharmac will conduct 100-mark practicals for internals beforehand, that is even before your prelims. Usually in prelims, both Patho and Micro will also conduct 100-mark practicals, but Pharmac will conduct from the beginning. The advantage is that you get accustomed to the format. But for MUHS, the format becomes slightly different. For the practical aspect, as you can see, the 70 marks is constant. But 5 marks each get added to Viva 1 and Viva 2. That is paper 1 topics and paper 2 topics. So that brings a total of 30 marks. There are no marks for journal in MUHS, but completed journal is required for entering the practical. So that is regarding the basic mark distribution. Let's start with the first question, that is clinical pharmacy. Now, clinical pharmacy includes 3 sub-questions, that is dosage form for 10 marks, ORS preparation or IV drip setting for 5 marks, and dose calculation for 5 marks. Starting with dosage forms. So this is the easiest and most scoring aspect because this is directly out of general pharmac. The tube of the ointment or the gel or the paste will be kept in front of you, or the vial or the ampule will be kept in front of you. There will be 2 basic questions. One is either identify the dosage form. Second will be tell its advantages, disadvantages, and examples of drugs that is being given. That's it. It is that easy. So just keeping your eyes and ears open will fetch you full marks even in this. The answer is right in front of you. There are a lot of resources to approach this. It can be the department PowerPoint presentation, which was shared with us towards the end of our second year. We'll share the PPT on the group. It includes photos of the various dosage forms of the spots that are kept in the exam. Sushruth folder, it contains many charts which have the common topical dosage forms and the oral dosage forms, like difference between the normal plain film tablet, entering coated tablet, divided tablet, scored tablet, etc. So that you can refer in Sushruth folder under the dosage forms. And lastly, there was certain presentations for earlier batches for the 2012 and 13 batches, which were made by faculty for revision purposes. We will share that as well on the group. So to summarize, dosage forms is very easy. In the internal exams, you might have it in the form of a viva where the examiner will just hand you the dosage form and ask you regarding its advantages, disadvantages. Prelim onwards, generally it is kept as a spots only in the initial exercise. Coming to ORS or IV drip setting, now you can get either of this in MUHS. It depends a lot on your luck. ORS is obviously the easier one. The department will provide you certain checklists just before the prelim exams and even before MUHS as well. Just follow the steps that are given in the checklist. You can easily score full marks in this because this is just again 5 marks. Now, ORS is obviously easy because the steps are straightforward. You just have to cut the packet, proper hand hygiene should be done before that. Mix it in a 1 liter container, stir it properly. Then certain basic questions will be asked to you regarding the procedure. That is, what type of water will you use? So the answer is boiled water, which has been cooled for a certain period of time is used. Then you might be asked about the various types of ORS. That is the low osmolarity preparation, conventional preparation, Rizomal, etc. That can be asked to you as well. These are scoring aspects. If you just read it once or twice, it is enough to score full marks. IV drip obviously is the more difficult aspect of this question. So whenever the practical is held, attend it without fail. And whenever revisions are held, just go and practice. Because the more you practice, the more comfortable you will get while doing the actual practical. IV drip conventionally, it becomes a sort of a feared or a difficult practical to, just go through. But with practice, you can overcome that as well. Again, the department will give you a basic checklist for that. But ultimately, remember, though it will be a mannequin on which you will be inserting the IV line, not a real patient, but treat it like one. So whenever you get that question, the examiner will be sitting in front of you with a copy of the checklist itself that will be provided by the department. So based on that, you will be getting marks. If you perform everything in that, obviously you will get full marks. So treat it like a real patient, greet it, perform a hand hygiene before touching the mannequin. Make sure that your hands are warm. Make sure that, say, if gloves are required, you're wearing gloves, etc. Check the IV bottle if it is in upside down. Check the date of expiry of the tube. These basic things, and just explain while doing it. Now I will be checking the expiry date of the IV bottle. Now I will be placing it inverted on the stand. If you say these things, the examiner gets it that this person is involved in the process as well. That does help regarding this question at least. Now coming to dose calculation, it usually is 2 questions of 2.5 marks each. And the calculations are easy, but sometimes trick questions can come. Again, depends a lot on your luck. So for solving these questions, you should know all the general pharmac formula like loading dose, half-life, volume of distribution. You might be asked certain questions regarding drip rate as well. So the formula regarding drip rate, or you can just derive it on the spot. Then regarding the empiric calculations or the metric calculations, where if suppose 100 ml contains say 10 milligram, then how much will 500 ml contain? So certain questions you can use common sense, but for some questions you need to know the formula as well. So make sure that you practice regarding this. The department might have conducted a practical regarding it. So just go through the questions once. Similar questions are asked, not exactly same, but similar. And apart from that, if you're using Marrow or PrepLadder or any coaching platform, there is usually a question bank set which is regarding this particular exercise. So just go through that as well. Then coming to clinical pharmacology, it contains prescription writing for 10 marks, prescription criticism and rewriting along with justification for FDC for 10 marks, ADR identification or ADR reporting for 5 marks, and lastly P-drug list for 5 marks. Prescription writing. Now this is the single most trickiest aspect of the entire practical. Usually you can get one single drug prescription and one multi-drug prescription. The single drug prescription is for 4 marks and multi-drug for 6 marks. The department provides a prescription booklet towards the end of the year, or maybe in your case, they might give it a bit earlier because in our case, they had to modify it as per the CBME curriculum. So the troublesome part that will keep you awake in the night before the exam. So it is better to start preparing earlier. Read it. Make sure you read it multiple times. Learn the common conditions first, like learn urticaria, learn about, say, status asthmaticus and status epilepticus, then go for rare conditions that are there, then run for the management of a patient who had an acute MI and you need to manage him for 1 year. So these conditions are rare. They generally won't ask such difficult conditions in the exam. Basic conditions like say amoebic hepatitis, malaria, you need to know these first, then go to the rare conditions. Now, so all the drugs in that booklet, they have a particular dosage and over a time period that it needs to be given. You might have to give an anti-malarial like Primaquine for say 5 days, chloroquine for 14 days. Whereas for say urticaria or for the oculogyric crisis and myasthenia, you need to just give a single injection dose of promethazine. So that differs over the time period as well as the dosage. It can be 25 milligram for promethazine, whereas for anti-malarials, it can be 150 milligram. So again, the dosage differs for each prescription. But in case you don't remember the dosage, it is fine to take a qualified hint, but at least be accurate about which drug is used in which condition. You can't write that a beta blocker is used in asthma. That will be a completely gross error and you will get a straight 0. But if you at least write that in status asthmaticus, you will give a MDI salbutamol and a steroid, a long-acting steroid through the MDI. So that can be something which can fetch you marks, even if you can't remember the exact dosage. If you just make a educated guess at least, that can fetch you marks. But the first priority should be key, remember the dosage accurately, remember which drug is given in which condition properly, and follow the proper format. The modified Maharashtra Medical Council format is usually the one which we are told to follow. So this is a sample of that. This is in the prescription booklet as well. So just a few changes that you can make here to score a bit more. So again, Dr. ABC, MBBS, KM Hospital, Paril, date, correct. Just write prescription number here. Firstly, 1, 2, 3, 4, 5, 6, anything. For Mr. XYZ, age, sex, weight, address. Yes, you can write that. Write the diagnosis for the condition for which you're giving. So suppose this is capsule amoxicillin 3 capsule thrice daily for 5 days. So this is probably for an upper respiratory tract infection. So just write the diagnosis here, upper respiratory tract infection. In treatment now, there is an error here. If capsule is okay to write in one capital letter and the remaining letters can be small, but amoxicillin, this should be written only in capital letters. Again, this is the format which is followed. Thrice daily, you need to write instead of say TDS, or for twice daily, generally the shortcut used is BD. You can't write that, right? Twice daily or thrice daily properly for 5 days, to follow up after 5 days. Follow-up information, dietary modification, say in a patient with hypertension. All of these aspects make the prescription complete. So all these things you need to keep in mind. So suppose there is a prescription in which there is a capsule and there is a tablet, say in leprosy, where rifampicin is a capsule, but the rest like Dapsone are tablets. So in that case, capsule needs to be written first. If there is an injection, it needs to be written first, then capsule, then tablet after that, in that case. So all these things, they are there in the instructions regarding how to write a prescription. Just go through that. Remember that writing the basic format is half the work done. After that, it is just using your common sense and your logic regarding what drug is used in what condition. Coming to prescription criticism and rewriting, this is like the elder sister of prescription writing. So basically, you will be given a question, a scenario where a patient will be having a clinical condition and a prescription will be given to them. What you have to do is criticize the condition. That is, see whether now there are two types of errors of omission and errors of commission. Omission means that something is not there in that prescription. Commission means that something extra or unnecessary is added to that condition. You have to focus on that and not on the format of the prescription which is given there. Usually, this is a multi-drug prescription. It can be, say, for diabetes mellitus, that is for a patient who is resistant to metformin, resistant to sulfonylurea. So what will you do next? It can be that, or it can be a case of, say, drug-induced Parkinsonism, where you have to correct the prescription. So focus more on the drug which is being given for the condition, whether it is correct or not, whether something needs to be added or excluded from the prescription. Then you have to rewrite it in a proper format. Same regarding the format, it is same as the previous question. Only resource for this is your prescription booklet. So you know how important the prescription booklet is by now, and rewrite it in proper format. Coming to FDC, FDC stands for fixed dosage combination. It is the easy part. Exclusively, you can refer to Sushruth folder because all the exam questions are covered in it in a presentation with proper justification. It won't be asked outside that. Let's take an example. Suppose you are asked to justify ethinyl estradiol and norethisterone. So usually a dosage is also given. Ethinyl estradiol is usually in microgram and norethisterone is in milligram. So you have to keep aware about the units as well. Usually they can confuse you regarding the units, and suppose you write it as a rational combination and come, and later you realize that no, both the units were in micrograms, so it becomes irrational in that case. So be careful while reading the question. Usually easy questions are asked. So suppose this is a question on ethinyl estradiol and norethisterone. So as you can see, the justification is given quite well in this case. It is just basic physiology and you are modifying the physiology to achieve an outcome in this case. This is exactly same to same taken from Sushruth folder. All of these things are given, just go through it properly. Coming to ADR identification and ADR reporting. In ADR identification, usually two pictures of ADRs are given to you. You have to write what is the ADR first of all, identify the ADR, and then write the drugs causing it along with the related question. Usually it is about the mechanism of the drug. Now, Sushruth folder contains old images because Sir had compiled a folder in around 2014 or 15. But you can revise it because he has listed all the drugs causing a particular ADR in a very systematic manner. However, the department had a new PPT which contains all the new ADR images. Usually the PPT is conducted usually the practical is conducted towards the end of the year. So just Be aware, take photos whenever the practical is conducted. So that is regarding ADR identification. Regarding ADR reporting, we are using the WHO form version 1.3 currently. You have to read the question carefully and fill the details in the form accordingly. Usually, as per Naranjo scale, you are given a probable or a possible ADR. Now, this is again highly scoring. If you fill it properly, you can score out of marks in this as well. So let's just take an example of, say, an ADR reporting form first of all. As you can see, this is version 1.3 of the IPC. So patient initials need to be written: age at the time of event, gender, weight, date of recovery of the ADR, and date of when the reaction has started. Describe the reaction or problem. It is usually given in the question. Just summarize it properly. Leave AMC report number, registration number, worldwide unique number blank. Relevant test or laboratory data, again, usually given in the question. Relevant medical history, again, given in the question. So fill accordingly. Seriousness of the reaction, obviously, if the patient is dead, you will be given in the question. So mark as death. If not, then seriousness, yes, and as per the scenario, life-threatening or hospitalization. Then regarding outcome, whether recovered, recovering, fatal, and so on. Then coming to suspected medication, you have to write the brand or the generic name, manufacturer, batch number, lot number, expiry date, dose, route, frequency. All of these are again given in the question, so just read it properly. Then regarding action taken, whether the drug was withdrawn, just mark a tick mark over there. And if he was taking any concomitant product, again, fill it according to the format. In reported details, Dr. ABC, KM Hospital, or any ABC Hospital, XYZ Hospital, anything, PIN code, email, telephone number, just fill anything, occupation, signature, date of the report. That's it. If you fill this properly, that is all. And just as you can see, causality assessment here under suspected medication, probable, possible. Usually that is the thing that is given to us. Second picture is an ADR of moon face caused by corticosteroids. So this is quite a common ADR, which is given in the question. Apart from that, certain classic images are given, like warfarin-induced skin necrosis or gynecomastia caused by a variety of drugs. So you can just list out the drugs. You can make your own notes for that, or you can refer to Sushruth folder as well. So this is regarding ADR reporting. Coming to P drug. For P drug, common conditions like gout, migraine, peptic ulcer disease, diabetes are asked. So you need to know the drug classes and then subsequently individual drugs. At least 4 classes and at least 4 drugs from the class that you're going to choose. Use step criteria. Now understand what step criteria stands for. The S in step is not safety, it is suitability. Mention if it suits patient profile. Make a table, write the classes on one side. Suitability, efficacy, tolerability, price are the 4 columns. Suitability, yes, suits patient profile. Efficacy, write the mechanism of action of the particular class. Suppose if it is a case of asthma and you have to give the beta-2 agonist. So the options available are beta-2 agonist, inhaled corticosteroids, the adenosine receptor, and PD inhibitors that can be given. So just write all of these down. Under suitability, write down if it suits patient profile. Efficacy, write the mechanism of action. Tolerability. Now, whatever common adverse drug effects that you know about that particular class, just list them down. And in price, use your common sense. Obviously, beta-2 agonist is going to be cheaper than a monoclonal antibody. So just use your common sense in that. Now, do not use plus signs. That is, if something is highly suitable, don't put 3 plus signs or something like that. Write in proper sentences, because putting plus signs is going to again cut your marks. Write it in full sentences, because that can get you full marks. Then once you have chosen the class, mention that this class has been chosen as the most suitable class here. Then list down individual drugs under the class. Say if we choose beta-2 agonist, write salbutamol, formoterol, indacaterol, vilanterol. Write that down. Again, write about the suitability, efficacy, tolerability, and price. Usually the only thing that will differ in this case is the suitability. Because if the patient is having acute attack, then you need to give a SAPA, that is a short-acting beta-2 agonist, inhalation. So write that down, that it is more suitable. Again, write it in full sentences, don't write in plus sign. Now, some people have the justification that P drug is a personal drug, but at the same time use common sense. That's it. Coming to experimental pharmacology and communication. Experimental includes IM injection, that is intramuscular injection, or CAL software, that is computer assisted learning. So again, depends on your luck what you will get. For IM injection, again, there will be a checklist, same as IV. Treat the mannequin like a real patient, explain what you're doing to the examiner. Coming to the computer assisted learning, it is basically a software program where certain drugs are being injected into a model of a dog. So it can be easy or tricky depending on what type of question you're going to get. They will share the software program with you towards the end of the year. You can install it on your laptop and just go through test runs for it if you know the questions. Usually, and if they haven't covered it in this format as of now, then they will ask you, instead of this, they will ask for graphs. So those graphs can be anything. It can be about tachyphylaxis. It can be about drug antagonism. So just see the graphs in your journal and go through according to that. Usually drug antagonism, vasomotor reversal of date, tachyphylaxis, all of these are asked. So as you can see, these are questions from ANS and general pharmac. So you need to be strong in that aspect. As you may be asked questions after, once you perform the practical, you might be asked questions about the mechanism of the drug. So how does ephedrine cause tachyphylaxis? These are things that can be asked. If you know that ephedrine is a mixed acting sympathetic agonist, you know how it will cause tachyphylaxis. So be aware of these aspects as well. Coming to communication, you are asked to communicate a single drug prescription to a patient. Usually the examiner acts as a patient in this case. This is again dependent solely on your soft skills. Read the case. There are 4 R's that are given in the form that you fill in your journal. So follow those and be calm and polite when you're doing the practical. You can communicate in Marathi, Hindi or English. जी भाषा आवडेल, जो भी examiner को preferable है, or whatever you feel comfortable with. Just ask the examiner which language would be preferred. Like in my MUHS exam, I had started speaking in English, but sir said to communicate in Marathi. So you can switch as per that. That is not an issue. But whenever you are given the question, read the case properly. Usually the prescription is also written in that case. Read the prescription, communicate properly, explain the basic disease to the patient, explain where the drug should be stored, in what conditions it should be stored. Explain regarding the adverse effects of the drug, what should be done in that case. Explain regarding follow-up. At the end, ask the patient to repeat. If the patient is not able to repeat or has some doubts, clear those doubts. Assure the patient. That's it. As simple as that. Again, highly scoring. Coming to Viva. Now, this is again something that is parallel to your theory exam preparation. It is better to know something about everything rather than knowing everything about something. Usually basic topics are asked. In paper 1 Viva, at least from general pharmac, you will get one definition. Like, what is the difference between pharmacokinetics and pharmacodynamics? Adverse drug effect definition. So make that those general pharma concepts are clear. In paper 2, sometimes questions can be asked about miscellaneous topics like chelating agents, probiotics, prebiotics. Rarely about, say, anti-cancer agents. Again, that is rare. About immunosuppressants. So keep a basic idea about them as well. Again, if you're short of time, then it makes sense to focus more on the high yield topics. Like you can for sure be asked a question from ANS. So be aware about that. Don't spend time on miscellaneous topics if you have not done ANS properly. So that is again at your description. Don't give time specifically for theory. But as in your case, for this first internal, your practical is before your theory. So it is good to have a basic revision regarding your theory. Revise from whatever source which is fast. It can be your own notes, it can be Marrow notes or DAMS or Ranjan Patel review book or Govindra Garg review book. Smart work is always prefer over hard work. And again, use your common sense. You can't say nausea, vomiting as a side effect of ondansetron, which is an antiemetic. So be careful regarding that. Use your common sense. Lastly, regarding pharmac, how much ever you prepare from the beginning or how much ever you try, you can never be 101% confident or 101% prepared. But it is a good practical. No one will go purposely to fail you out of their way. Be careful, use your common sense, but at the same time, the portion is vast. So prepare accordingly, start preparing early on. That is it from my side. Good luck. Now Kshitij will conduct the further session about pathology.
Good afternoon. So we'll be starting with how to deal with practicals in pathology. So remember that pathology is like a bridge which connects the preclinical subjects to the clinical subjects. So let's start with that. So how to pass pathology practical exam. So you will be assessed based on your skills to identify histopath slides, then about gross specimen, clinical case and its diagnosis. In HEMAT, you may be asked to perform DLC and blood grouping, then CBC report interpretation, and finally the practical would end with clinical trait viva. So let's start with histopath slide. Now I have discussed with you regarding histopath slides in great detail. So we'll just summarize in short. Very important is to identify the slide and to make the correct histopathological diagnosis. Uh, and regarding that, the resources which you should use are journal and seniors PPT. If you are interested more to learn about histopath, then you can of course refer to VTERS. Regarding the slide identification, you will be very thorough. You will be the slide identification part can be very easily done if you are well versed with that and well versed with theory also. So read the green boxes of Robbins at least, and what first of all in histopath slides, first of all you need to identify the slide, then you need to write the points which help you to identify that slide correctly, and finally you need to draw the diagram. So for some students it might seem a little tedious to draw a diagram, so they can refer Ramdas Naik or Harsh Mohan, but if you are well versed with the particular theory, if you know the points by which the particular slides can be identified, then it's very easy. You can just depict what you are seeing in the slide without and depict all the features in the diagram which help you to diagnose this condition and differentiate it from similar condition, and that's it. You don't need to worry more about what to write and how to draw. Then histopath slides are generally asked as a spotter and as a grand slide, and a viva is conducted on the slide. So in viva, related questions are asked. So most important part in histopath slides is to identify the slide correctly, and rest everything will follow. So now we'll move on to gross specimen. So again, in the gross specimen, the first point is how to identify the correct identification of the gross specimen. You have to correctly identify which the specimen to which organ is this, and then the correct description has to be there, and then finally you end with giving the appropriate diagnosis. The description part is more important than giving the diagnosis. So even if you know the what specimen it belongs, and if you fail to describe it correctly, then you will not get correct, you will not get good marks. So if you want good marks, you need to know the you need to describe it correctly. We'll see the description through an example. So just before that, we'll complete with the resources. So resources, again the same green box of Robbins, senior PPT and Shushrutsar folder. If you are interested, you can visit WebPath. That is a website where you will find n number of histopath gross specimen, and you can study from that site as well. Again, the gross specimen are seen in spotter, and there is separate viva on gross specimen. So let's see the gross specimen through an example. Suppose this specimen is asked you in viva. So first of all, you need to identify this organ. So this is obviously the coronal section of the uterus. This is so this is uterus with its endometrial lining. This is the cavity, uterine cavity. This is endometrial lining. Then this is a myometrium, and covering the myometrium is the thin lining of the perimetrium. So this is the coronal section of the uterus. So first of all, you need to describe the organ. Then you need to describe what the pathology you are able to visualize. So what you are seeing here in the myometrium, you are seeing these large masses which are solid in nature. So, and then comment on its size. So the size is ranging from, let's say, 5 centimeter to, let's say, about 2 centimeter in diameter. How many such lesions are there? So there are about 7 to 8 lesions which are there. Then where is the location of this lesion? It is present in the myometrium. So some of them may protrude into the serosal lining, or some of them may protrude even into the endometrium. So then what is a color? And for example, this is the pattern that you can follow in all the tumors that you will come across. Where is the lesion? What is the size of the lesion? What is the color of the lesion? Are there any secondary changes which you can see? For example, these secondary changes are necrosis, hemorrhage, and calcification. Necrosis is seen as friable tissue. Hemorrhage are seen usually in the form of blackish color discoloration, and calcification is seen as white hard material which is getting deposited. So here in these large masses that you are able to visualize, all are solid, they are not cystic masses. Then you cannot find out any of these secondary changes, so there it is a homogeneous in appearance. Then you need to comment on whether it is infiltrating or whether it is well circumscribed. So all these points will fetch you marks. So the correct description could be that this is a section of uterus which shows about 7 to 8 lesions which are solid masses which are present in the myometrium, which range from 5 centimeter to 1 centimeter in diameter. They appear to be homogeneous and grayish white in color without any secondary changes like necrosis or hemorrhage or calcification, and they appeared well circumscribed without infiltrating into the other nearby tissues, and of course they are well circumscribed. So like that you can describe for any session. So there are some professors which like to hear this word that fresh formalin fixed jar mounted gross specimen. So some of them may even don't like that. So my general advice is that don't speak such words. You can directly start from describing what is the organ and then move on. So with that example, so let's move forward. This is a webpath site where you can get various different kinds of gross specimens on general path, systemic path. So if you are interested to know more in great depth, so you can always visit this site. And then we'll go to the third point, that is clinical cases and CBC report interpretation. So for now, internal exam, you will have only CBC report interpretation, but in final exams, there can be different clinical cases like jaundice, leukemia, MI, all these cases can come in your final exam. So regarding clinical cases and CBC report, first important point is to know the correct diagnosis. But some of you have this habit uh, of knowing mugging up the each individual case and their diagnosis. Then the examiner may caught you and ask you how you reach to that diagnosis, what are your differentials. So you should know the cases thoroughly. You should know that what is their correct diagnosis, what are the various differentials, and extra investigations to rule out all the differential diagnosis and reach finally to the final diagnosis. So you should know the clinical cases in theory, and clinical cases there is no such need to study them separately. Just read your cases from your journals, their answers, and you should be well versed with the theoretical aspect of those cases. So they are generally these cases are put in even in auspice stations, and even separate viva is conducted on based on the clinical cases and CBC report. So let's take an example. So I'll just give you 2 minutes, just go through this case and come up with these answers. You can type the answer in the chat box. Yes, so don't sit calculating the MCV, MCH, just give your diagnosis, causes of anemia, and further investigation. Question number 2, 3, and 4.
So guys, you can also put this in chat box. There is a male of 10 years with complaints of lassitude, weakness, and lack of concentration. On examination, pallor is seen. You can see the investigations with reduced hemoglobin, and you can see that morphology is hypochromic and microcytic. You can also see that in DLC, eosinophil count is 10%. So what do you think it is?
Let's keep this session a bit interactive. It's not going to be just us talking. You also have to participate actively.
You can either give final diagnosis or any of the differentials that you have thought about. So you can also write about what can be the cause of iron deficiency anemia in this 10-year-old child, or some any other differentials that you can think of.
A hint for this is look at the eosinophil count and look at the economic status.
Yes, think of microbiology in this aspect.
Yes, so we'll move forward. Yes, some of you have correctly guessed. So this is a case of a 10-year-old child who has come with the microcytic hypochromic anemia. So type of anemia in this case is microcytic hypochromic anemia. So for hypochromic anemia, for microcytic anemia, there are four differential. First one is iron deficiency anemia, second one is thalassemia, third one is sideroblastic anemia, and then there is anemia of chronic inflammation. So how you can, so these are the so this is the way you need to describe this case. So they can ask you how you can rule out other things. So this is a 10-year-old child who comes directly with this complaint. There is no any history of previous any infection or any other comorbid condition, so we can rule out anemia of chronic inflammation. Now since this child is presenting at 10 year and there is no any underlying hepatosplenomegaly, so this rules out the thalassemia. Thalassemia could be either alpha or beta. Alpha thalassemia presents at very early age, so that could be even a 6 months. Beta thalassemia usually presents at a late age, maybe early childhood or adolescent, late childhood, early adolescent. So in that period, so this is a 10-year-old child, so this might be a case of beta thalassemia. But the point that there is no hepatosplenomegaly keeps the beta thalassemia at very lower side. It could come at second or third differential. Then we should talk about again sideroblastic anemia. It's not that common, but you should mention about sideroblastic anemia as a differential for a microcytic hypochromic anemia. So it's more likely to be an iron deficiency anemia. Now, what can be different causes of iron deficiency anemia? There are n number of causes ranging from nutritional deficiency or high demands, as in case of pregnancy. But in this case, as Harsh has pointed, that there is an increased eosinophilic count. So increased eosinophilic count points towards the parasitic infection. So this is a case of maybe a hookworm infestation, and that has resulted into blood loss, which has caused the microcytic hypochromic anemia. So then talking about further investigation, so you can talk about serum iron levels, ferritin levels, total iron, TIBC count, and definitely the stool specimen should be taken to rule out any worm infestation. So likewise, the cases can be asked to you and you have to go accordingly. You should be well versed with your theory topics to master in the clinical cases. So with that, let's move forward. So now coming to the final part, that is clinical tray. I will just brush up through the clinical tray what they can ask. They can ask you about vacutainers, about the tubes, Windrose tube, Western green tubes, Sahil's hemoglobinometer, Newbar's chamber. They can ask you about different types of needle which are used for bone marrow aspiration, then the one which are used in liver biopsy, and then you have to correctly point out what are the findings that tells you that this is a bone marrow aspiration needle or this is a liver biopsy needle. So all these things are given in quite great detail in the seniors PPT. So you just go to that section of clinical tray, and all these quick short points are written. So they can this time in internal assessment exam they can ask about tissue processing, about molds, cassettes, all these things they can ask. So all the information is given very crisp, in a very crisp and short fashion in seniors PPT. So that is the best source that you can use to study clinical tray for clinical tray viva. With this, we come to an end on how to study pathology practical exam. I wish you best of luck. Study and ace your exams. I'm also thankful to Harsh for making this PPT and for proofreading, and also for both Harsh and Ambike for giving me this opportunity to speak on pathology practical exam. Thank you.
Okay, very insightful and organized session from both the speakers. Now we'll move to the third subject, which is microbiology. Over to you, Deban. A very good evening, everyone. After two heavily intensive and a lot of bulky subjects, I think we now move on to a subject which is probably one of the most easiest in your second year MBBS, which is microbiology. I am Deban Banerjee, a third year MBBS student at St. GS Medical College and KEM Hospital. And before I begin, I would like to thank the academic department for giving me an opportunity to speak in this webinar, especially Senior Secretaries Harsh and Amay. So I'll be very brief. I'll not take more than 10 or 15 minutes of your time because the subject itself is very small. Just a brief overview about the practical in microbiology. Microbiology as such does not have a lot of activities per se in the practical point of view. You just have 3 or 4 main exercises which are to be performed neatly, and it's a practical which is highly scoring, and I'm sure every one of you will score very well in this. So moving on to the components in the microbiology practical, I have taken this from the MUHS document on microbiology. So you have gram staining and ZN staining. As per my knowledge, being your first internal assessment, you will most probably have only gram staining for this internal and ZN staining in your second internal. And in your prelims and MUHS final exams, you will be given to do either one of these activities, which includes a viva on this as well after you perform it. The second activity being a stool microscopy and a peripheral smear for detection of malarial parasite, and a viva on this as well. As per my knowledge is concerned, you mostly will have the peripheral smear or malarial parasite, and depending on whatever practicals have been conducted. We also have two other components in the microbiology practical, but per se, it will not be asked in your internal assessment. This is something which you will get in your prelim exams or MUHS practical exams, which is hand washing or PPE and interpretation of lab reports. I'll briefly speak about them, but I do not have any slides for you. After that, you have a theory viva, followed by your marks on your logbook and journal. I guess there is no journal per se for microbiology, only have the logbook to complete here. So moving on to your first thing, which is gram staining and ZN staining. It is something of a, it is the only, maybe I can say, the practical thing which is to be done in microbiology. It is an easy step. I hope at least every one of you have been to your practical on gram staining at least once, because as per my knowledge is concerned, the department conducts multiple sessions on gram staining for practice and explaining the stuff. So nevertheless, before your practical exams, I would suggest you read the steps which are involved in gram staining and ZN staining. You can use any source of your choice. I used Shastri, which is Apurva Shastri's textbook on microbiology, the chapter on laboratory investigations. It has the steps well enlisted, and you also have a diagrammatic representation. And I would also suggest you see the minute details in gram staining, which can be asked in your viva, which includes the time for which you keep the dye, and the thing that we have to wash the slide after every step of staining, which is something you have to keep in mind. I suggest you read the steps in detail so that you do not miss it out while doing your practical. When it comes to your viva on gram staining and ZN staining, it is important that you have a little bit of knowledge about the historical aspect, as in who invented the gram staining technique, the year per se. You can have some teachers who are going to that depth to ask you questions. Again, coming to gram staining, there is a paragraph in Apurva Shastri which is saying about the modifications which are used, like Kopilov and Biermann's modification, Brown and Ben modification. Just have a slight read about that. What are the changes per se which are different from the core technique of gram staining. Then again, coming to the uses, you have a nice box made out in Apurva Shastri which states the 5 or 6 main uses of gram staining. Coming to some specific details of ZN staining, you need to have a knowledge of the different concentrations of sulfuric acid, which can give you the staining for different types of microorganisms. There is a table made out there in Apurva Shastri where you can refer to. Again, an NTP grading is something which you need to know for ZN staining. It is a part of your practical that you grade the slide which is given to you. So please read up about the NTP grading, you know, the 0, scanty, +1, +2, and +3. And a very basic point to keep in mind, please tell it as the NTP grading, because, you know, you may be reading some textbooks which state it as RNTCP. The program's name has changed. It's now the National Tuberculosis Elimination Program. And one more important thing in this gram stain and ZN stain is that after you have stained your slide and you have done all the steps and viewed it under the microscope, you have showed it to your teacher, it's important that you write your interpretation. And there is a very specific format which is to be followed while writing the interpretation. I'm sure your teachers in microbiology have shared it with you on the Telegram group. You need to follow that exact same statement which has been shared so that you know, you get full marks and don't lose marks unnecessarily here. Again, a small tip, please do practice the basic diagrams of gram negative, gram positive, bacilli, cocci, and the NTP classification and the ZN staining whenever you go for your exams. These are easy diagrams, but I would just suggest just have a quick look through them so that you do not end up making any mistakes, because these are easily scoring marks and you do not want to lose them. So that would be all regarding gram staining and ZN staining. It's an easy part of your practical. It's just that you have to be calm and do all the steps properly and not mess up unnecessarily. So moving on. Again, what I have reinforced earlier as well, just follow each step, and something you'll just realize when you go for your exam is that you 3 or 4 of you do it together. So please stay in the company of your friends and do it in a group so that you do not end up making some mistake. You know, you'll obviously have your friends there performing, so you can also get an idea. Again, a little under the table advice that in case by chance your slide didn't get stained as per what you wanted, you can obviously use someone else's. And you also need to have a proper knowledge of using the microscope properly, use the proper positions of the condensers and the diaphragms. You please have a look at that, because there are many people who use it in the oil immersion field and the diaphragm is at the lowest levels and people say that I am seeing the slide. So that's a very basic error and that's something you should not do. So moving on. Coming to the next part of your practical, which is the stool microscopy and peripheral smear for malarial parasite. The stool microscopy part, the department per se asks a fixed number of parasites. I have made the list as far as I could recall. There is Ascaris, hookworm, strongyloids, H. nana, entamoeba, and giardia. So my suggestion to all of them who have not at all done anything in this part, to please go through these organisms first. You need to know everything in detail about the life cycle, the infective stages, the treatment, and the lab diagnosis, you know, the morphology of the eggs or the larva, whatever is seen. Please go through these first before you jump to any of the other parasites which are there, because those do not usually come in the exam, and these are the ones in which the exam usually revolves around. Coming to the peripheral smear for malarial parasite, there are just 2 slides which are there, which is Plasmodium vivax and Plasmodium falciparum. So my advice would be to just read about the differences which are there in the peripheral smear, laboratory diagnosis, and the other techniques which are used. A picture here, I guess most of you can identify there are multiple ring forms in this picture. So in a single RBC, so this is a slide of Plasmodium falciparum. Vivax would show single ring forms, and there are schizonts which are also seen. So I hope these are points which have been covered in the practical, and these are very basic points. So just keep an have a knowledge of these points so that you can just easily identify the slide. And I'm sure you have seen it in your practicals when they were being conducted. Again, likewise in gram staining, you have to draw diagrams after you see these slides and the stool microscopy. So please practice the relevant diagrams of the eggs and the larva which you see in the slide. Practice it from any source of your choice. I have done it from Apurva Shastri. The diagrams there are easy and they're reproducible. And another tip is that we do read all this stuff in textbook, but when it comes to identifying it on the slide, it's sometimes a little difficult because the dimensions are all different, and what we come and see from the textbook is something which we not see very practically. So I guess the teachers from microbiology may have shared photos with you on Telegram, and if not, we can share it with you. And again, I hope at least every one of you have at least been to the practical once or twice, so you have been at least exposed to how the slides and stuff look and how a gram stain actually looks under the microscope. So please have a look at them. Again, just like gram staining, these are short marks, very easily scoring, provided you just don't do any gross errors. So I would always suggest just do it properly. It's a limited number of parasites and a very limited thing to study. So you can easily score marks in this one. And an additional word regarding the peripheral smear, please also have a look at the other laboratory techniques which are used for diagnosis of malaria, and a little knowledge about the life cycle, the incubation periods, and a word about the treatment. These are some things which can be asked in the viva which follows this activity. So coming to the theory viva per se, again, I guess what Amay and Kshitij have told, it's better to know just a basic of all the things which are there rather than to know very deeply. And microbiology as such is a subject which has a lot of fancy names, terms and all. But when it comes to your university exams, it is basically the common infections which we see in the clinical setting, which is most commonly asked to us. So my suggestion to all of you would be that since it's your exam time, please limit the spectrum of your preparation. First, complete the main areas of the infections which have been, which are commonly seen and on which a lot of classes and lectures have been done. You can always go to those rare infections and exotic infections once you're done with that. So again, a few basic tips for your viva. Just be confident. However underprepared you are, you should not be showing it that you are not prepared. Be confident as much as you can. Speak as much as you know, and please make sure to choose your words wisely, because there are times at your viva when you are asked that tell me a topic which you have read properly. So please go with the ones you have read thoroughly. So that would be a suggestion from my side. Again, what I've said just earlier, please read about the infections which are commonly seen in a clinical spectrum, before jumping onto those exotic infections. Just know a little bit of basic about the pathogenesis. You need not go into very much of detail regarding the receptors and the secretion systems. Like if you ask me example like cholera, you need to know a basic mechanism of action of the cholera toxin, that it acts by increasing the concentration of cyclic AMP, thereby increasing the secretions in your intestine and inhibiting sodium reabsorption. Again, microbiology per se only revolves around this point, which is lab diagnosis. You need to know the lab diagnosis in detail of all the important organisms. I guess that's something you all have been doing, preparing a IMPs. It's basically something which is the same thing. Just read the main techniques which are involved in lab diagnosis. Lab diagnosis is just not about PCR and antigen antibody detection. It's, you need to know a little bit about the culture media and stuff. Again, with the advent of this CBME curriculum, you have the system-wise approach to microbiology rather than the organism-wise. So it's also necessary that you approach it in that way, knowing the common list of organisms which cause common things like diarrhea, anemia, endocarditis, etc. It has been given beautifully in Apurva Shastri, and any other resources you follow, I guess they also have a list on that. Coming to two other sections in microbiology, which is the general microbiology and immunology. General microbiology, please have an idea about the various microscopes and their principles which are used, and a little bit about the historical aspect. The first few pages of any microbiology textbook will have all this, Louis Pasteur, about Robert Koch, their important contributions. This is something which a viva is commonly asked on in your first internal as well as in your final exams. Immunology, again, if you are interested, well and good, you can obviously go into detail, but when it comes to your college exams, something very basic is asked in immunology, like, the hypersensitivity reactions, the antigen antibody reactions, the various tests which are based on that. So I would suggest you read them first before moving on to the details in immunology. So that will be all. Again, what I've said earlier, speaking too much or too complicated or too high-fi things won't fetch you any extra marks. It is necessary that you stick to the point which is being asked to you, rather than going haywire and telling some very difficult culture media or something which is not even clinically very relevant. So my advice always will be to please stick to your basics before going to the higher level of stuff, because there is a certain limit which is asked, and please answer to the point. Do not beat around the bush. That is something no examiner likes. So again, a little bit of just to tell you, assure you again what I've said it in my before I've begun, that it is one of the easiest practicals in second year MBBS. Not very intensive, not a lot of things to read. It just requires a little bit of few hours of dedicated preparation on the day before your exams. I don't think any one of you require to not sleep the night before. It's a very there is a very limited spectrum to ask in microbiology, so you can easily cover it up. Again, the department is very cooperative and helpful, so you can always take their help. It's a highly scoring subject. Please don't mess it up. So again, all the best. Thank you. So a very practical advice about practicals in microbiology, I must say. Thanks a lot, Deban. So now we come to the Q&A session. So basically, if you have any questions, you can put it in the chat box. Anything? So for FMT, your university exam will be in third minor, but yes, you will have to study for the practicals. A good source for FMT will be studying Rajesh Bardai and synopsis of Reddy. So for few definitions, it may happen that the examiner expects that you speak the definition given in Reddy. So a general advice will be, if you have time, then read those definitions. Try to remember whatever you can about the IPCs and related stuff. And you can, of course, study the conceptual topics like death and cause of death for FMT.
Regarding the practicals in FMT, you will be asked a question about age identification. So if you have been given journals, then we would advise to read that topic from in the proper certificate format. And apart from age identification, there are certain spots which are asked, like X-ray might be given, or fetus might be given. So you have to calculate. Okay, if journals haven't been given, then it is available in Sushrut folder as well. They haven't been given, right?
No journals.
Okay, so no journals have been given, right? So it is in Sushrut sir's folder as well. You can check from there as well regarding how to estimate age, what is the proper format for age certification. So that should be helpful, I guess, for that as well. And Viva is also there, and journal carries 10 marks. So I guess whenever you get journals, they will ask you to complete the same and then submit. So for FMT in general, just remember to be dressed formally. Boys have a haircut and clean shave before going to the Viva. Wear formal clothes, formal shoes as well. And
in general, for all exams, go well dressed. It is better.
Yeah.
Anything else? So for this, yes, it can become difficult for writing answers from Robbins. You can always refer to Ramdas Nayak if you have been following Robbins, because Ramdas Nayak kind of gives you a summary of Robbins and in point-wise manner so that you can write. Harsh Mohan is also an alternative to it. And there is no harm in following these authors. They are also well and good. But yes, Robbins gives you a conceptual overview and it bridges you to medicine, which is the basic advantage of Robbins. Anything else? Okay, so one more point that I would like to add is that in microbiology, there is a PDF by Apurva Academics and there is a YouTube channel by Apurva Academics. So there you can find good videos of gram stain, ZN stain, stool microscopy. So if you haven't got exposure in the labs, you can refer to those, and those videos are really good. They helped me in my exam, so I think they will also help you. All the speakers have given you a comprehensive review of what you should do. The key is to manage it well and plan it well. Basically, for practicals, there are some things which you can solve at that moment, even if you haven't prepared very well, for example, ADR form, if you read that case neatly, you can solve that question. For some questions, you will require 1 day preparation. So that 1 day preparation questions you must jot down now and make a checklist. Yes, that before going to the practical exam, I have to see how to make ORS. I have to see the important points in ZN state, in gram state. So these 1 day preparation topics are very important, and I think they will help a lot in scoring. Apart from that, there are topics which test your long-term memory and concepts. For example, in Pharmac, there is prescription writing. In microbio, there is lab report interpretation. And for these questions, you really need to be well versed and studied. And that is the cause of panic for many students, because if you haven't been thorough with your studies, what to do now? So a general advice would be, don't panic. Start with whatever you have, make something out of it, and never look back. So thanks a lot. I will like to conclude this session by thanking Vice Presidents of Academic Department, Dr. Smriti Vajpayee Tiwari ma'am and Dr. Swarupa Bhagwat ma'am, for letting us conduct this session for you guys. I think you have really benefited from this session. So that's it from our side. Thank you.